Hey everyone, welcome back to my channel. My name is Stephanie and this is all about my life after gastric bypass surgery. And today's video, I'm gonna be a little complainy, so I'm sorry in advance. Do you guys ever feel like you just have absolutely no motivation and you're just kind of dragging your feet through every day waiting for something to happen where you just kind of feel like yourself again? Of course you do. That's a very human experience, and that's exactly what I'm going through. And I think a lot of it honestly has to do with the fact that I just came back from vacation. So of course this last week has been my first full week back to the normal routine, back to the grind. And although it hasn't been difficult, in fact, work has been so much nicer than it was before I left. I was so busy and so overwhelmed before I left that vacation was like needed, or I was gonna shut down completely, and it has not been that bad coming back. So thank you. Whoever's in charge of that, thank you. Even though it hasn't been that bad though, I just find that I have no motivation, no real desire to get back to my routine, or not necessarily a lack of desire to get back, but just like I'm just not feeling it. I just spent this whole last weekend just not able to decide what I wanted to do to spend my time, and ultimately being unhappy with every choice that I made. And I've also noticed the last few days I've been particularly tired and particularly grumpy, so I think I'm just a little bit off. And although I had a really great video planned for today, I just don't have the desire, the time, or the motivation to do the proper research for it. And I don't want to put out something that I haven't completely researched and vetted to the best of my amateur abilities. That's just not how I roll. So I'm going to go and fall back on what I'd like to call, I think, the petty complaint corner. I have a few things that I've been taking notes on over the last several months that I consider petty complaints. They are complaints that I have, that I've seen in the community, that I've seen from other, pre and post-op patients, and just things that I feel are just worth complaining about. And I'm in a complaining mood. So if you're not the kind of person who wants to hear some complaints, then maybe this isn't the video for you. And I may have wanted to say before this point, when you decide to turn away and not come back to my video, that if you're a returning subscriber, thank you so much for continuing to support my videos. I very much appreciate it. And if you are not yet a subscriber, I just ask that at the end of this video, or maybe choose one of my better videos, maybe choose one of my research videos. If you like that kind of content, then please just consider subscribing to support the research and the content that I am putting out there, and ring the notification bell so you are always notified when a video of mine goes live. So I'm just gonna jump into a couple of complaints that I have that are sticking out like sore thumbs, that are always bothering me. If you are traveling to Mexico for bariatric surgery, please get your passport. Tip number 1, get your passport. Can you travel to Mexico without a passport? Yes, at least as far as I know, at least as far as the filming of this video right now, yes, you can. That doesn't mean that it won't change, especially with times like this, with COVID. There are things changing constantly. One of the points of an enhanced driver's license is to be able to allow you to go, across the northern and southern borders a little bit more freely. So it is possible, but I just don't understand, if you're the kind of person who's concerned about it, get your passport, and then there's no concern. If you want to travel internationally, just get your passport. It is the easiest foolproof way to know that you'll be able to get across the border and get back without any concerns. Now, from my experience going to Mexico, we did not stop 1 second when we went across the border. So we just drove into Mexico. Nobody asked to see anything. Nobody stopped us. Nothing happened. So getting back into the US, are you going to run into an issue where they literally won't let you back into your home country? No. I mean, ultimately, no. You're going to be able to get back home. whether or not you have now created a problem for the van full of post-op people who just want to get to the airport and go home is another thing. Now, again, if you've done the research, if you know that you have the documents that you need and you feel confident in that, then that's fine. That's fine. But the easiest, foolproof way to travel internationally is to get your passport. And what I see more often than not are people scheduling their surgeries and then freaking out about what documentation they need to get their surgery in another country. And it just drives me crazy. So my biggest tip, if you are looking to get surgery in Mexico, get your passport first, then schedule your surgery date. And I know you don't want to wait for your passport. You've decided now that this is what you're going to do and this is what you want to move forward on. I get that. I understand. I felt it too. But I also made a decision in August and scheduled my surgery for December. And I already had my passport. So, that's not part of this. But I made the conscious decision to not get it as soon as I was physically able to. I made the decision to get it when it made sense in my life to go ahead and do it and to give myself time to prepare more for that. So you're not in a hurry. No matter how badly you think you're in a hurry, you're not in a hurry. Get your affairs in order, then schedule your appointment, and then go. It would save so much time and effort and worry. People are so worried all the time. And the follow-up on this is, don't take some random person on Facebook's advice on what documents you need to travel internationally. Hello, kitty. If you are worried, if you are like, I don't have a passport, I'm not going to be able to get a passport in time, what do I need? Why would you ask Susan on Facebook what her opinion is? Oh my goodness, do not travel internationally based on Susan's opinion alone. For crying out loud. Stop asking Facebook questions that are medical in nature or international travel in nature. I'm also seeing tons of questions constantly about COVID testing. The COVID rules have changed since I had my surgery done. So I can't tell you 100% for sure what the rules are right now, other than that I have heard that you're required to show a negative test before you can go into the hospital for surgery. And Mexico Bariatric Center is allowing you to do that through them, so you can contact your coordinator, you can let them know that you need that. They will make sure to get the details figured out. You just have to pay for it and they'll work with you on that. So it's not like you have to figure it all out on yourself. Which is another thing with all of this, is that everyone seems to think that they have to figure this out on their own. And contact the company. For crying out loud, contact Mexico Bariatric Center and ask them. Now, I will say, sometimes their coordinators aren't super great at getting back to people timely. So maybe don't wait until like the week of your surgery to contact them and ask them those questions, but they will get back to you. They will tell you what is needed. They will work with you and help you through it. You don't have to figure all this out on your own. That's what they do. They do medical tourism. So let them do their job and tell them what you need and let them help you. And along the same kind of vein where we're talking about medical tourism and international travel for medical stuff is this whole idea and this whole concept that I keep seeing that is having a very high and simultaneously very low expectation of getting surgery in Mexico. And it's completely contradictory constantly. I'm seeing people have the same thoughts all the time about surgery that is just, it's confusing to me. So a lot of times I'll see a lot of comments and questions and concerns regarding how much English they're going to know and how you're going to be able to communicate with people. Sometimes people will talk about how they weren't able to communicate with people and it was a really big deal. There are very few people that do this, and I really truly think that there's just a handful of people who have extraordinarily stupid expectations. You're going to Mexico for surgery. You cannot expect it to run as if you're going to a United States hospital. It's just not gonna work. Not everyone is going to be 100% fluent in English. Not everyone is going to run the same way as a US hospital. It's just not the case, but it is a US based company and they still are a hospital. I mean, I just don't really see how you can expect it to be a certain way when you're going to someone else's country to get this procedure done on the cheap. Having this really high expectation that everyone's going to be extremely fluent in English and they're going to be coming and checking on you 24/7 and asking, you know, if you need your bed sheets tucked in and just like catering over you, that's not what you're going to get. Do you need that? No, you absolutely don't need that. But if that's what you're looking for, maybe you should get it somewhere else. But the same people who have this very high expectation of this experience also have an extremely low viewpoint of Mexico, which is just driving me nuts. And I see constant worry about, where do you put your stuff while you're in surgery? Where do you put your purse? Where do you put your money? How do you know that your money is not going to get taken or your valuables aren't going to get taken? And the first thing I want to say is, would you have the same conversation if you were getting surgery in a US hospital? No, you wouldn't ask, where do I put my valuables? You trust that that is a safe space for you to put your valuables. But on top of that, why would you see so many great experiences and so many great reviews of Mexico Bariatric Center if they're just constantly stealing from clients? I just don't understand. I was nervous and I forgot completely about my stuff. And I got wheeled off for surgery and I just left everything, including my phone, just sitting out. Completely didn't occur to me that maybe I should take care of my stuff. And when I woke up, I was in my bed. They had put the blanket over me. My phone was sitting next to me on the little table that was next to my head. And it was like things were just nicely laid out and set out for me. They were very caring and kind and respectful of my things. And I never once thought that somebody was going to walk away with my stuff. So if you're going to go through and book this medical tourism experience and book this surgery out of country, stop running around thinking that they're going to, be this third world country that is just eager to steal your stuff. So if you've decided that you're going to trust these people with your surgery and you're going to trust these people with your life, then why don't you also trust them with your stuff, please? I made this wonderful glass of tea before I sat down, and I've been so worked up that I completely forgot about it. Also, I'll try to insert some positivity in here. I just bought these yesterday. They are sugar-free shortbread cookies. I love shortbread cookies. They're my favorite ever. And in all honesty, most shortbreads that I find have pretty low sugar in them. And so I will have one or two occasionally. But I found the sugar-free ones and I said, ooh, I want to try that. And these are so good, which could be a problem. So I'm going to have to really make sure I'm only having a few with my tea. That's my little treat. There's some shortbread and some tea. But they're really, really yummy. So just FYI. If you're looking for, just something to kind of curb a sweet tooth and have maybe with a glass of tea. I have a list of quite a few things that I jot down here and there, but I'm just going to touch on, I think, one more and call it a day so that I can move on with my night. But it's one that I see quite frequently, and it's probably the pettiest of all of my complaints, and it has to do with the incisions and the look of the incisions after surgery. I see a lot of talk on which doctors people can schedule with who are not going to include a drain, who are going to do the fewest incisions on you, and then also a lot of discussion on whether or not the single incision is something that they can do And it all boils down to an aesthetic thing. People are worried about having scars and they're worried about the look. Just from a purely anecdotal observation, it seems like a huge chunk of people are going through this surgery with aesthetics in mind, wanting to get to a certain body type, a body look, and are willing to, after surgery, go through with plastic surgery to remove excess skin as well. I think that the statistics would show that the vast majority of people don't actually get plastic surgery and skin removal surgery afterwards. I don't know for sure, and I might actually do a video on that so that I can do the research and try to understand a little bit more. I would guess that most people don't do that, but there's a lot of talk on social media, because it's social media, about skin removal surgery, and what I see a lot is Brazilian butt lifts and mommy makeovers. I don't want to get into that whole conversation, but I do want to touch on the petty complaint I have of so much talk about how things look after surgery and being concerned about the scars. I have 5 incisions, 5 little scars, and they are very, very light. You can't really see them all that much. Not that I run around with my stomach exposed really anyway, but you really can't notice them that much. In fact, you can probably see, I've got one there. I've got, oh goodness, they're around here somewhere. I've got stretch marks. I've got one here that's right at my bra line that's hard to see. There's one over here somewhere. One here. They're very hard to notice, and if that's something that's super, super worrisome to you, there's a couple of things to keep in mind. One, if you're the kind of person that's super, super worried about your scar and how you're going to look after surgery, you're most likely the kind of person who's willing to get skin removal surgery also if you have loose skin. And that whole thing will pretty much be taken away if you get skin removal surgery, because they will pull everything and most likely get rid of any of your incisions anyway. And then you're going to have a bigger, more noticeable scar from the skin removal surgery than you did from the laparoscopic weight loss surgery anyway. So the whole conversation is moot. But it's really, really frustrating, and it's something that I just want to put out into people's minds to keep in mind. It is absolutely not something that I want to be a big deal and for everybody to cater their needs to people like me, but I do think that it is worth putting out there that there are some people who get this surgery and it has absolutely nothing to do with aesthetics. It has absolutely nothing to do with how I look. It has to do with being healthy and being almost 400 pounds. I see this a lot from people who are maybe going into surgery and they are my current weight now as their starting weight, or they just started at a lower BMI in general. There's absolutely nothing wrong with choosing this surgery if that's the choice that you've made, regardless of what your BMI is. But I think it's very important to remember that a lot of people, this is their last resort. This is something that they did because they've tried everything else and they've been heavy their whole lives, and they were, close to 400 or 500 pounds. This is very different for somebody like me than it is for somebody who is 230 pounds and really worried about losing the weight so they can wear a bikini next summer. And I'm not judging anybody for their reasons for wanting weight loss surgery, or even the fact that you want to look good afterwards, because Lord knows we all want to look good, regardless of the fact that I didn't do this for aesthetics. I still want to feel like I look good at the end of the day. But if that's your main worry going into this surgery, about how many scars you're going to have and how it's going to look, and whether or not you can hide the fact that you got bariatric surgery, you are on a very different path than me. And it gets exhausting to read stuff like that all the time when you're the kind of person who feels like this surgery may have actually saved your life, versus, allowed me to feel comfortable in the crop top that I wore on vacation. I just want to put it out there because I think it's important, not that we all cater our behaviors and our words to other people, but that you're at least aware of other people's struggles and aware of the way that your behavior may come off to somebody else with a different background. I just really recommend that people take a long, hard look at the reasons why they want to go through with surgery, because this is not a quick fix, as many people will tell you, and it's not an easy path. And if those are the motivations only, you're gonna have a really, really, really tough time, because it's really, really, really hard. And if it weren't for the fact that I really feel like this saved my livelihood, I don't know if this would be worth it simply for the way that I look in a dress now. You know, I don't know how that would weigh out, you know, if I were to really weigh things out. Call me petty if you want, but that's why I'm calling this Petty Complaint Corner, and I will bring it up again another time when I need to get a video out to you guys and I have no other content. So look forward to that. Thank you so much for putting up with my complaining and my throwing together a video this week. Hopefully in the next week or so, I'll start to get back to my routine and feel a little bit more like myself. But until then, I'm just going to keep plugging along and hoping for the best. And I should probably go play with my dog. So I'm going to go do that. Stay happy and healthy. Always make sure to keep track of the big picture, and I'll see you guys in the next one.